All right, thank you everybody for coming out to our third installment of Torah workshops. It looks like we have another great turnout. For a change, we're not having Linda and Larry Jones speak this time. I actually have Nancy Pietroski coming in. She's someone I've known for a long time, a clinical pharmacist and also a national registered EMT. Originally, she's from Eastern region. She was patrol with me at Bear Creek. She's also at Spring. Also Nordic patrol for Valley Forge, Nordic and Philly. And then unfortunately she left us to move out west with her second job, career in retirement, which I believe now you are with Mount Bachelor.
Yep.
In Oregon. And then from what I'm reading, you're also involved with the US Forest Service yet.
Mm-hmm.
So Nancy's also busy. She's also an editor-in-chief for International Society of Travel Medicine, and I believe also Wilderness Medicine magazine. So do you ever take a break at all, Nancy?
Nope. Nope. That's what everybody says when you retire, you're even busier. So, but with fun stuff. So,
Yeah. But yeah, like I know Nancy's always been trying to see what we've been doing, always asking how she can help. And I thought with her background and everybody's talking about wilderness EMS, wilderness medicine, I thought, you know what? She's still a pharmacist, she's still a patroller. Here's a way that we can get her back involved. And she agreed to speak tonight. So before I turn it over to her, she wanted to just kind of get a little background with everybody. So what I'm going to do is I'm going to send two things in the chat. One's a QR code. The other one is a link to Multimeter. Let me just pull that real quick. What we're trying to do is, and I'll share my screen shortly. With this first one, what we want to do is to see everybody's background. I know most are patrollers, some are EMS providers. So once you guys get that, if you could, for the first one, just select what you are. If you have dual certifications, feel free to select many options. ALS other, ALS BLS, that's other certifications that I don't have listed. This way she kind of gets a feel of what the class is.
16. All right, we got 18. Wait a few more seconds.
And just so you know, we have 37 people actually logged in right now. That number may change through, the next couple of minutes.
Okay.
Looks like majority of your audience is patrollers.
Okay, great.
With
Okay.
that. And then a bunch of EMTs and scattered EMS certifications.
All right, great.
So, all right.
Okay.
So what I'll do is I will switch the screen. So Nancy, it's all yours if you want to start sharing.
Okay.
And then when you're ready for the next multimeter slides, just let me know and we'll switch back.
Okay, so I want to welcome everybody. Can you see this okay? Yeah, I'm looking on mine.
Yeah.
I'm Nancy Pietroski. Eric gave me a great introduction. I'll tell you a little bit more about myself, but this is my doggy this morning. I shamelessly exploited him and made him go out in the snow so he could have snow all over his fur so you could see that it was snowing. So that's Bodie. Okay, so what I'm going to do is go into the presentation. Now, see, this is, hold on one second. Sometimes the bar in Zoom covers up the controls. Hold on one sec.
While she's doing that, if you guys could all put your first and last name in the chat for me, because there's a lot of names on here that are either nicknames or they're just initials. I need to do that for a QR. I mean, sorry for continuing that.
Okay, this isn't letting me share now. More. There we go. Okay, can everybody see this?
Nah.
No. Ugh. You know, you practice all these things and all right. How
There
about
you go.
that? Okay, here we go. Okay, let me minimize these guys. Hold on one sec. Sorry about this. Shit. Excuse me one second. Share. I'm trying to minimize the there we go. Okay, perfect. Okay, here we go. So we are here today to talk about wilderness pharmacology. And when I first suggested this to Eric, he reached out to a number of us, as he said, to give some of these lectures. I was not thinking that it was going to be 2 hours long, which actually I could talk for 20 hours on pharmacology, but wilderness pharmacology is a very, very specific area, especially for practitioners that aren't usually administering drugs. So what I've tried to do is make this, it's less pharmacology and it's just more practical stuff for anybody that wants to recreate or work or do other fun things in the wilderness. So first, a little bit about how did I get here? And again, Eric told you some things about my background. I'm a pharmacist. I did an infectious disease residency, and this was all in Philly. And then my career, I was a hospital pharmacist, and then I did clinical research. I did retail, corporate. And now that I'm pretty much retired. I retired from my last job in January. I'm still an editor for Wilderness Medical Society and for the International Society of Travel Medicine. And the certifications I have, and the reason I'm so stoked about giving this lecture to this group is because Eric and Eric and Rich did an amazing job putting together the EMT bridge course. And I was one of the first graduates of the course, and I'm eternally grateful for this opportunity. And I've tried, now that I've moved out west, there's just not that much focus on it. Like nobody has any programs out here. I think it's one of the very few, if not the only program in the country. So it's absolutely fabulous. Some of the other things you see there, this is a fellowship in the Academy of Wilderness Medicine. Some of these certifications have expired, but these are all courses I've taken, and you can see the theme is I just love wilderness medicine. So this is advanced wilderness life support. I did a bridge course with another patroller out at Blue Knob who does wilderness EMT bridges. CTH is Certificate in Travel Health, Wilderness First Responder, Wilderness First Aid, and then I'm also a volunteer ranger for the Forest Service out here in Oregon. So I've been on NSP for 25 years, as Eric said, at Bear Creek and Spring and at Valley Forge, Backcountry and Bike Patrol. I've been an OEC instructor and instructor of record. So the bottom line is I just love all this stuff, especially the medical part of it. Okay, so now we're going to do a quiz, and we'll have Eric take over. This is just sort of break the ice here. So if you have done your QR code.
Yeah. Just Let me
Let's,
switch over real quick.
yeah, let's see if this works.
All right. So I will switch to the next one now. Okay. So the first question is the corpse discovery exploration is most commonly known as. Choose which one you think is the best answer. Helps if I actually share it. So
All right, looks like most people are, the answers are in, and yes, it is the Lewis and Clark expedition. And what did you, I didn't see what you put for the other one. Let me get out of here.
I just did some random ones.
Okay.
I didn't
All
want to
right.
control this.
Okay, and the next one was what was the starting and ending point of the Lewis and Clark expedition?
On your with this one, you guys, this one's a little bit more interactive. You just had to click on where you think it started, and click on where you think it ended. Uh, I'm not sure if I'll be able to do it off my desktop since I'm sharing.
Oh, that is so cool. I love how you did that.
I don't think anybody expected to do a history lesson as well.
This is great.
We'll give it another 30 seconds before Nancy gives the answer. And Nancy, you want to give the answer?
Yeah, so it started in St. Louis, Missouri, and went to the Pacific Ocean. So this was basically an exploration of the unexplored western part of the country, or the middle and the western part. And then how many men, because it was all men, except Sacagawea, everybody's familiar with her, was the one woman that joined the expedition at some point. But how many men died on this expedition? So it wasn't Sacagawea. And the bonus question is, were the causes of death?
Well, let's just get through this first question first, then I'll get the others.
Okay.
So, and I apologize, whoever put the lines on, I cannot clear that, so. Give it another couple of seconds. You ready for the answer, Nancy?
Yep.
It is
Okay.
actually,
Go ahead. All right. So there was only one person died on this expedition. It's absolutely fascinating that they were in such hostile and dangerous territory, and only one person died. And the cause of death was thought to be peritonitis. And then there's a new theory that it was an aneurysm, but the long held theory is that it's peritonitis. And that was one thing they absolutely could not take care of because they didn't have the proper surgical equipment, or nor were they surgeons. Okay, great.
you wanted me to skip this one then?
Um, yep.
All right, I believe that's it. So I'll stop sharing and go back to you.
Okay, great. Okay, this is not letting me do this. All right, let me try this again. Okay, I wanted to do that as a little icebreaker. Okay, now you're seeing my screen. Okay, because we're going to be talking about wilderness medicine and pharmacology in the wilderness. And this was there's been 3 books written about the Lewis and Clark expedition, and if you haven't read, well, Undaunted Courage is the classic one about the expedition itself. And then there's 3 books here. Only One Man Died, Lewis and Clark, Doctors in the Wilderness, or Perish in the Attempt, which are really, really good uh, stories about what type of medicine that they carried and how they prepared to get ready for this. And again, the absolutely astounding fact that only 1 person died. Okay, so we're going to talk a little bit about wilderness medicine. So one thing that Eric and I were going to try to do is I was going to look at chat and see if I can answer questions during the presentation. So I'm going to be glancing back and forth. I actually turned my video off to see if I can answer them during the presentation. So, and he's going to be alerting me to any questions that may be coming up. So we'll pick good breaking points for us to do that. So anyway, so let's just give a definition of wilderness medicine. So the strict definition, which is in one of the more well-known textbooks, is it's medical care delivered in those areas where fixed or transient geographic challenges reduce the availability of or alter the requirements for medical or patient movement resources. So in other words, it is not street medicine. And then wilderness EMS is the systematic and pre-planned delivery of wilderness medicine by formal healthcare providers. Okay, so basically we're talking, this is what we're doing on the slopes. We're transporting the patients down. We are transferring them to an ambulance versus in the backcountry. So here we are getting someone out either by brute strength, lifting them up, or a helicopter and getting them to higher level care. So from the survey we did, seems like the majority of the people on this call are ski patrollers, but everybody is medically trained in this group. And so I'd like to talk about different environments where you can use your medical skills, either personally or professionally, and not just on the slopes, and where you can or cannot step out of your scope of practice. So first, there's a textbook out there. It's the only one of its kind that talks about the discipline or the idea of wilderness medicine. It was put together by a physician, an ER physician down in North Carolina, Seth Hawkins. And in this text, there's actually a new version coming out. This one's about 6 or 7 years old. I wrote a chapter on wilderness EMS pharmacology, and this is where a lot of this information comes from. But as well, former speakers, if you were on previous calls, Linda and Larry Jones, the eminent Linda and Larry Jones, also wrote chapters in this book. So wilderness event medicine and management of cold injuries. And also in the textbook is technical rescue interface ski patrols. So this gives you an idea of where ski patrols, besides just working at resorts, where they're working in more remote, dangerous, austere environments, and the types of things that have to be done by those patrols. So if you're interested in wilderness medicine, I encourage you to pick up that book. And also, let's see if I can do this. I want to share the site of the Wilderness Medical Society. Larry and Linda and I are all members of this. I'm not sure, I think Rick Chandler is. I'm not sure how many other people are members of WMS, and there are other organizations that do some teaching, which I'll talk about in a second, wilderness medicine teaching and courses. But if you're interested in wilderness medicine at all, definitely join WMS. And if you go to their website, wait, let's see. This is where, hold on. This is the live version of the site. And so this is a new tagline that we came up with a couple years ago. And if you want to go to any sort of conferences, they are listed here. They have all sorts of really, really interesting adventure education, and you can get CE credits for this. So if anybody is interested in any of these types of things, it's absolutely fantastic. And then the other thing that is available to the public, and you don't have to be a member of WMS, I think it's like around $200 a year, is this Wilderness Medicine magazine, which I'm the executive editor for. And we had a redesign several years ago, and I just think the magazine is absolutely fantastic. So we're constantly populating it with new columns, and the range of articles in here just is fantastic. We have breaking news, we have featured articles, and then we have core columns depending on what your area of interest is. So Basecamp RX is pharmacology. That's the one that I write. So if you're interested in anything that has to do with drugs, there's that. And then climbing, expedition medicine, tactical wilderness medicine. So I highly encourage anybody who's interested in all about wilderness medicine is to take a look at this website and maybe join or at least read some of the articles here. So going back to, okay, hold on one second. The presentation, these were just all screenshots. There's conferences that are available, as I said. So you can either take WMS's conferences, or there's a local one that I went to a number of times when I was living in Pennsylvania, and it was put on by St. Luke's. There's a group of docs that started this, I don't know, 10 or 12 years ago. And I think they put it on every 2 years. So they did one in 2024. And then also on the East Coast, there's the Appalachian Center for Wilderness Medicine. They do some really, really cool things. In addition to running courses, they also do conferences, but this is just strictly a conference. And then there's a group besides WMS that puts on these adventure CMEs, and they're always like in the really coolest places. And you can get CE, not only CE, medical education, but other disciplines as well. Okay, so now we're going to get into the meat of the talk. So if I didn't get you excited about wilderness medicine, hopefully the rest of this will get you excited about it. So here's reasons to leave home or out of the ski resort and get out of your comfort zone for work or play. So you could be doing tourism, some sort of adventure or backcountry travel for which you're going to need to be prepared. Education, travel abroad. You may be basically going to any other country is out of your comfort zone, and you want to be educated about where you're going and how you can prepare. If you're doing disaster and humanitarian aid, how to be prepared for that. Field research, if you're getting your PhD and you're going to be studying at the pyramids in Gaza, in a desert environment. Of course, military service can take you anywhere if you're a missionary. So these are all places or things that you could possibly be doing that get you away from home. Okay, so here's a Venn diagram that is asking these questions. Where in the world are you going? Okay. What will you be doing? And in the middle of all this, what illness or injury can occur with these activities and these places that you're going? So the next couple of slides, I'm going to talk about different environments and different diseases that could possibly, or conditions that could possibly occur. Okay, so you could be going to the mountains, and the types of conditions that you'd be experiencing in mountains are altitude, so acute mountain sickness, cold, so hypothermia and frostbite. You could be experiencing lightning strikes more than you would at sea level, sun and heat conditions that are out of the ordinary. If you go to desert environments, you've got sun and heat, and then you have animals that you don't necessarily have in other environments, like very venomous snakes or scorpions. If you head to tropical environments, you could be susceptible to bites and envenomations, especially marine animals. Again, your sun and heat, depending on where you're going. Infections you can get just about anywhere. Um, if you're in some type of water environment, whether you're on a river trip or whether you're diving, or I just got back from the Virgin Islands, we were sailing. So if you're on a sailing trip, um, you are at risk of drowning, of course. If you're diving, any sort of dive injuries, bites and envenomations. Um, I'm thinking of people that have actually gotten killed in Africa by hippopotamuses that are hippopotami that are or crocodiles that come out of the water and pull them out of their boots. So anything can happen. Again, infections you can get from drinking water, exposed to water, cold or heat. Any kind of travel period, when you're on a plane, you're susceptible to everything that's going around the plane, respiratory infections, bites you can get anywhere, food and water, eating or drinking contaminated food and water with any sort of travel. And then another one are disaster zones. Again, because you've got damaged infrastructure, there's often a high probability of contamination of food and water, infections. Of course, trauma and disaster zones. There's the giant earthquake that just happened in Myanmar and affected Thailand as well. So people that are responding to that have to really be prepared for what they're going to face when they get there. And then, of course, stress if you're working in this type of environment. Okay, so the body systems that can be impacted on trips. Okay, so we're going to go through these pretty carefully because I want everybody to get a good feel for how all of these environments can impact your body in different ways if you're a traveler in these environments. So the central nervous system, the affect, and if you notice, I have all of these that begin with the letter A. I tried to come up with a little algorithm here so you could try to remember these things. So central nervous system, basically, if the CNS gets affected, especially the brain, the affect can be affected. And so that's your level of consciousness. That's what I mean by affect. And then another A word is apoplexy. And if you're old enough, you know that this was a term that used to be used for strokes. So strokes are another element of damage to the CNS system. And this isn't necessarily something that's going to happen because of the travel, but someone could have a stroke during travel, and then you have to be able to deal with it. Again, as I pointed out in the previous slide, any kind of bites, and bites can cause infections, and bites can cause basically infections or trauma. That's what I'm trying to think of. Respiratory, so you're thinking of anything that's affecting the breathing. At altitude, your respiratory system is affected. And so that can lead to acute mountain sickness or high altitude pulmonary edema. And then anaphylaxis, of course, affects the respiratory system. Envenomations, same thing as bites, getting bitten by the bites up here, I'm thinking of more like mosquitoes and other types of vectors that carry infections. And then envenomations are snakes and scorpions and things like that. And then something that is our bread and butter that we deal with all the time, of course, is trauma. So the A word for that is aches. So anything musculoskeletal. And, that's pretty much probably 80% of what we're dealing with as ski patrollers. But these are all the other things. And again, infections can happen anytime and anywhere. Okay, the senses, so ears, eyes, nose, and throat. You can get ear infections, eye infections, the flu, COVID, any of those types of things. The cardiovascular system, the A word is artery, so people can have MIs, they can have uncontrolled hypertension, any of these types of things. The gastrointestinal system can be affected, so that's the abdominal. And then chronic medical conditions. This is something that you always have to think about, because we'll talk about when you go on a trip or organize a trip and you're responsible for other people's medical care. People may come with chronic medical conditions, and these can turn acute if the drugs are not taken or if they're put into an environment that may exacerbate the condition. And, we do this on the Hill. We're asking people for their medication history. And that may, we're looking at mechanism of injury and nature of illness. And so if someone did not take their medication this morning and they have a fall, for example, was it because of the medical condition, or did the trauma cause the medical condition? Okay, and then now we're going to talk about medications to treat them. So I can't possibly go through all the zillions of drugs in the whole entire world, but this is to just give you an idea of what you need to be prepared for if you're going to be working in a backcountry situation. So, for example, central nervous system, we would maybe want to use anti-anxiety agents for people that are having issues in a wilderness environment. For bites, again, you can have infection or trauma. So the types of things you might be using are topical anesthetics, antibiotics, antivirals, depending on what was doing the biting and what disease it caused. For respiratory, you are thinking of things like albuterol, which is for asthma attack. Acetazolamide, if anybody's ever traveled at high altitude, or you're actually just going skiing in a out at Crested Butte or some of the other higher ski slopes, you may want to take acetazolamide to prevent acute mountain sickness. Epinephrine, of course, for anaphylaxis. Higher level providers are dealing with intubation meds for ACLS type stuff. And envenomations by snakes and scorpions, you may need antibiotics if there's infection from the envenomation, and then also there's specific antivenoms for some of these attackers. And then for trauma, you've got your aches, so you're giving analgesics and anesthetics to handle that, in addition to doing your physical splinting and things like that. And just to note, I'm not going to go into any of equipment or devices. We're just going to talk about drugs in this lecture. And then infections. So the types of things you're thinking about with infections are antibiotics, antivirals, antiparasitics, antifungals, those types of things. Okay, for the senses, anything going on with the ears, eyes, nose, and throat, you may need analgesics for pain. Think about when you have a cold. Anesthetics, if someone has a sore throat, there's local anesthetics, antibiotics or antivirals. If someone's having a cardiovascular issue, the drugs you're thinking about are aspirin, epinephrine, nitroglycerin, and again, the ACLS meds as well here. If there's abdominal issues going on, antacids, antiemetics, antidiarrheals. Antiemetics are preventing vomiting, antidiarrheals. And then any dermatologic issues, you could be having allergies or infections affecting the skin. So there's a whole raft of drugs that we use to treat that. So antihistamines, steroids, antibiotics, antifungals, antiparasitics. And again, with the chronic medical conditions, if someone is on your trip or under your care and they develop an exacerbation of their chronic medical condition, you want to be prepared to help them deal with that. And then the last thing, I made a little note here to remind myself. So space is the new frontier, and there's a lot more space travel going on now, especially with consumers, rich consumers right now, that can go out in space. So there's a lot more research being done on what happens to the drugs themselves in space, which we'll talk about, and then what happens to the body when it's in space. And if drugs are being taken by the person who's in space, is there any different effect? But I'm not going to go into that specifically here. But we're going to be hearing a lot more about space medicine in the future. And in fact, Wilderness Medical Society is coming out, their journal, which is Wilderness and Environmental Medicine, is coming out with a supplement on space. So that'll be really interesting. Okay, so all these drugs I mentioned, they're either prescription drugs or they're over-the-counter drugs. And so everybody knows the difference. Prescription drugs, you have to get a prescription from your doctor. And over-the-counter meds, you can just go into not only a pharmacy like CVS, but you can go into Walmart. You can get them online. Amazon's selling them. Mark Cuban is selling them. So, and you are responsible for what you are buying over the counter. You're the consumer. And the FDA approves all prescription medications. And at one point in the history of the drugs that are over the counter, they were prescription drugs. And then a decision was made after research and panels and voting and et cetera, that drugs could be made available to the consumer, that the consumer was responsible enough to take this drug into their own hands. I'm not sure that some of these are always the best idea, especially since a number of medications can be taken together and everybody's not always informed. But we'll talk a little bit more about that later. So what you need to consider is if it's a personal trip, you take your own prescription medications, you take your own over-the-counter medications. But if you're a trip leader, what do you do there? Even if you're traveling with a family member. I was talking to Eric about this, and Lyndon, Larry, and Rich when we reviewed this presentation. So I, for example, I have narcotics that I have left over from surgeries, and I'll bring them on a river trip or, a backpacking trip, just in case, God forbid, somebody breaks something. But you have to make a decision. If the prescription was written for you, ethically, you're really not supposed to be giving this prescription to somebody else. Same thing with antibiotics. And we know that humans are humans, and people, exchange drugs with each other and give each other things. But I'm very careful, especially as a pharmacist, to not give prescription medications to other people, even though I know a lot more than most people, unless you're in the medical field, about these drugs. But when you become a trip leader, that is where the responsibility becomes much, much more important. So if you're going to be leading a trip and there's going to be a group medical kit, which we'll talk about extensively, you have to make sure that you have the certification to administer this medication to somebody and the knowledge to do it. And so if people do not have the level of certification they need to administer certain drugs or make decisions about drugs, there are protocols that can be used, and this happens all the time in the hospital, where there's a medical director, and it's usually a physician. At our mountain, we have a medical lead who's a paramedic, and he can make some decisions, but he does it in consultation with the medical director, who's a physician at the local hospital. So there can be instances where someone who may not have the certification themselves to be able to administer something are allowed to do this under a protocol. So this is really, really important when you're considering which medications you're going to include in your medical kit, whether they're prescription or over the counter. Okay, so I see Mike has a question. all awesome things, but how do we acquire all these medications to take with us? So let me stop here for a second and talk about that. So like when I'm planning for a trip, if anybody's been on extended trip, you're going to Europe, you're doing that ski trip in Chile, or you're doing a river trip, you take medications with you, and I could do a whole lecture. In fact, if anybody wants it, I'll do a whole lecture on travel medicine. But you basically prepare yourself for you before you go on this trip. If you need vaccines, you get vaccines. If you need malaria pills, you get a prescription for malaria pills. You get a prescription for traveler's diarrhea. And you get over-the-counter medications for yourself. And again, as we go through this, we'll talk about different types of things. So you can arm yourself with your own medications. But if you're going to be a trip leader, you have to have the certification to be able to administer the medications. So, and you can get them working with, like if you're with an organization, let's say Knowles, for example, I don't know exactly how they work, but they have a group medical kit. And I'm sure they're under the auspices of a medical director who has prescribed these medications for them, and under protocols they can administer them. So in order to get a prescription drug, the bottom line period is there has to be a prescription written by a physician for it. So and again, it's a whole other discussion about how you equip a group medical kit with prescription medications. But you can take all the over-the-counter medications in the world that you want. But again, if you're the trip leader, and you have to consider what type of organization it is, and whether you're allowed to go into that medical kit and pluck out a medication for somebody. If it's a personal trip, yes. And anybody can take any kind of over-the-counter medication. So hopefully that answered the question. But let us go through some of this stuff, and we'll see if it clears it up. So the drugs that can be administered, prescription drugs that can be administered by most practice levels, and this includes OEC technicians, and I consider OEC technicians, I really hate that term technician, but OEC people have a certification that's similar to an EMT. Those of us who have gone through EMT training, or the bridge course, or just standalone EMT courses, know that the EMTs can't give a whole lot more than OEC can. And this really depends on the state. So it's state by state. And I'm just learning what's done in Oregon, but it's very similar to Pennsylvania. So it really is, if you're going to be practicing at the level of your certification, what you're allowed to do by your state. So all of us can assist with albuterol meter dose inhalers. There are nebulizers that can be given. And at our mountain, we have our pro patrol is, and the pros are basically people that are working full time. And they have certifications that range from woofer to paramedic. They are empowered by the medical lead and the medical director through a protocol and through training to administer nebulized treatments. So this is where they may not, like a woofer technically doesn't really have the certification to administer albuterol via nebulizer, but through a protocol they can. Wound care in general, we can apply burn cream or antiseptic. I don't know whether that's an OEC or not. And I was complaining about this the other day. It seems like OEC is getting more and more dumbed down, and they're taking stuff away from us. But hopefully we're allowed to administer burn cream or an antiseptic. We do in our aid room. So again, it may be a resort or organization type of guideline. Pain control. So as an OEC technician, and EMTs, I'm not exactly sure, are you allowed to give an oral analgesic? So that would be something like Tylenol or NSAIDs, like Motrin. At our mountain, we cannot. So we actually send them, which is absolutely ridiculous. We send them over to the gift shop where they sell little packets of Tylenol and Motrin. So as an OEC technician, and I think even our pros are not supposed to be giving oral analgesics. So again, that is just something that's governed by either the state or the organization that you're working with. The one thing that we all can do is we are trained to give naloxone intranasal for an opioid overdose. So it's not exactly pain control, but it's in that same category. So for anaphylaxis, we're all trained to assist with an epi auto-injector. But it's not autonomous, which means we can't go into the medical supply cabinet. And this happened at our mountain a couple of years ago. A guy came in with an anaphylactic reaction. I think he had eaten something in the cafeteria. And the NSP people who were in our aid room, we have both NSP and pros, were not allowed. He didn't have an EpiPen with him because it was the first time he had an anaphylactic reaction. We're not allowed to go into the trauma pack or the med supply cabinet and give the guy an EpiPen, which is kind of crazy. And so the ability to give an EpiPen that's not the patient's is a state protocol thing too. I think any of us in the wilderness, if we had an extra EpiPen, or borrowed somebody's EpiPen, we would certainly do that to save somebody's life. But technically, we are only empowered to give the auto injector. And our pros have been given the training and the power to use a multi-dose vial of epinephrine, and I'll show you that in a couple slides, where they actually withdraw it with a syringe and inject it IM that way. So they're allowed to do that. Two other drugs that we can give are aspirin and nitroglycerin. Again, most of us are trained to be able to just pull an aspirin out and give it to someone who's having chest pain or MI symptoms. Nitroglycerin, we can't pull nitroglycerin out of the closet, but we can assist the patient to give their own. Seizures, Diastat is basically Valium for status epilepticus. And in some states, there are advanced EMTs that are allowed to give this. That's not us, though. And then hypoglycemia, of course, we can give oral glucose. So again, this is pretty much it. When you think about the drugs that we're allowed to give as OEC people or EMTs, for the most part, it's these. So if you can't administer a certain drug, what would be an alternative? So here's some examples. So for aches and you want to give analgesia, a prescription product would be narcotics, or let's say COX-2 inhibitors. So the NSAIDs, Motrin and Aleve and all those, they're all over the counter. And then you get into these prescription drugs. I take Celebrex, it's great for arthritis, but it's prescription. So we can't just pull that out of a medical bag and give it to somebody. So what we can do, and again, not necessarily we can't be doing it at the resort, but if we are in charge of a trip or on a personal trip, these are the types of things we'd want to think about to be taking care of somebody who's got pain. So a combination, and there's some new information about this, and it's pretty cool. Combination of aspirin, a non-steroidal at the same time, and you can take Tylenol and Motrin and Aleve at the same time. And then Linda Lazowski-Jones told me about this, also taking Benadryl. And the antihistamine, Benadryl is an antihistamine, and it actually potentiates, which means it makes the effect of the Tylenol and the NSAID much more active. So that's pretty cool. And there are studies showing that it may afford narcotic level pain relief, which is very interesting. So for allergies and infections, for allergies, you can, from infections or derm issues or anaphylaxis, you're giving either a prescription, or higher level practitioners are giving a prescription antibiotic or a prescription steroid, which we can't do. But if someone's got a rash or swelling, we're giving aloe vera, hydrocortisone 1%. So that's an over-the-counter. And then Benadryl or Claritin if someone is having an allergic reaction. So this is something that I can't remember whether they teach this in whether this is in the book or not. But if someone is having an anaphylactic reaction, you give them the EpiPen, and then it should be followed by an antihistamine. And the best antihistamines are the ones that cause sleepiness. So Benadryl, or there's one called chlortrimeton, which is the yellow pill. They actually work better than the newer ones like Claritin. So again, these are things that we could give because they're over the counter. If someone has an infection, let's say it's like traveler's diarrhea, or they have a really bad cellulitis, a skin infection, prescription drugs or oral antibiotics like doxycycline is great for just about everything. Augmentin, a lot of us may have taken these drugs before. So in lieu of these, we can give topicals. So antibiotic ointment, so Neosporin, we give that out in our aid room. So you can offer that. Someone has a fungal infection, you can give them antifungal cream. And then any sort of abdominal issues, I call them the aches and the aches. So if someone's throwing up, Zofran is a great drug for nausea and vomiting, prescription. Compazine, suppositories. So at our level of practice, we're not allowed to, not only is this a prescription drug, we're not allowed to administer suppositories. So the types of things that we could do is meclizine, which is Dramamine 2. There's Dramamine and Dramamine 2. And as a public service announcement, I'll tell you that Dramamine 2, which is meclizine, is much better than Dramamine 1. So this is used for not only motion sickness, but for general stomach upset. Pepto-Bismol is great for traveler's diarrhea and just general upset. If someone has diarrhea, they can take Imodium, which is over the counter. So again, you want to think about if you're on a trip and you're not going to have prescription drugs with you, what types of drugs can you take with you to be prepared for any of these things happening? And if you've done these trips for yourself or with your family, of course you've done this already. So a lot of this is just common sense. Okay, so let's talk about drugs. More about drugs. All right, so I'm only going to show you 2 slides about drugs because pharmacology, to be frank, is kind of boring. So there's 2 concepts in pharmacology per se, and it's pharmacokinetics and pharmacodynamics. So pharmacokinetics is what the body does to the drug. You give someone a drug, it goes throughout the body, it does its work, and then the body gets rid of it. So it's how the body processes the drug. Pharmacodynamics is what the drug does to the body. So that's the effect that it's achieving in the body. So is it lowering blood pressure? Is it treating an infection? And pharmacokinetic processes are these. So absorption. So this is the drug movement from the site of absorption. And in the next several slides, we're going to talk about different routes of administration. So how a drug gets into the body. So absorption is how it's getting in there and getting into the circulation. Distribution, so how it's getting from the bloodstream or from the skin, or if it's given by mouth, how it's getting to the tissues where it needs to exert its effect. Metabolism, so this is biotransformation. So the body, once it's done its work, it's kind of like food. When you think about food and the nutrients coming out of the food and enriching the body has to get rid of it. So there's several detoxifying organs like the liver and the kidneys, and they get the drug out of the body. Because when you think of a drug as more of sort of a foreign substance versus food. And then the drug has to get out of the body. So it's primarily either coming out in the urine, that's the major site of excretion. It can come out in the feces, it can come out in the sweat. But basically, once a drug goes into the body, it comes out eventually. Okay, so I have a number of slides here, and we're going to go through these pretty slowly because I want everybody to understand the different routes of administration of drugs and some examples. So these are routes of administration that are available for all practice levels in EMS, and none of this is absolute. So I'll be talking about some exceptions. And again, this is a state by state thing. Things may vary, but pretty much any practice level in EMS for these ones that are in green, and then clinicians. So clinicians, for the sake of this, is basically physicians, PAs, nurses, pharmacists, respiratory therapists, sometimes chiropractors. All of these clinicians can actually prescribe and administer drugs in certain capacities. Of course, physicians can pretty much do this with impunity, but there are other healthcare professionals that can do this, a state-by-state thing. And as time has gone on, I've been in this business, I've been in healthcare a long, long time. These rules are generally becoming more broad, and there's more of these allied healthcare professionals that are able to administer drugs, which is great. So the first route we'll talk about is oral. Everybody knows what oral is. You swallow. So a tablet, a capsule, syrups, and solution. The rate of absorption of oral drugs is slow. It's through the GI tract. So basically, it has to get into the stomach's acids work on it. It has to go through the intestine. Sometimes the drugs go from the stomach to the bloodstream, but for the most part, they're going through the intestine into the bloodstream. For any oral medication, and we all know this, the patient has to be conscious and be able to swallow. And then here's able to assist. So FA is first aid. EMTs, which would be OEC. EMDs are emergency dispatch. I was trying to think of this. Emergency medical dispatch. There are some states where someone can be working, a trained person can be working in a 911 center and instruct somebody to take an oral medication. And then the ones who can actually physically give a pill to somebody you see there. And wait, let me skip ahead to this. So these are oral drug formulations. So we've got, and everybody should know this, we've got tablets that are in different shapes. We have chewable tablets. We've got time-release capsules. So anything that has layers like that in general is time release. I think that's melatonin. We've got capsules, soft gels, lozenges, and then gummies. The problem with gummies are they're easy for people to take, but they have a lot of sugar in them. And then there's buccal or sublingual. And this is where you're putting something either on the tongue or you're putting it in the cheeks. And it has a much faster absorption than oral, because again, oral has to go through the GI tract, and that just takes longer. And it also avoids what's called the first pass metabolism in the liver. Since it's going directly into the bloodstream from where it's administered, it doesn't get metabolized by the liver. And like oral, patients have to be conscious and be able to swallow. And then here's able to assist and who can administer. In general, there's not a whole lot of buccal medications. There's things called orally disintegrating tablets, and that's great for, there's some for migraines. So if someone's having a migraine, they really they don't want to take a swallow of water to swallow their pill because they're just not feeling great. Or Zofran, for example, the antiemetic I talked about, That's another one that's an orally disintegrating tablet. Some of these get absorbed right into the bloodstream, and some of them, they disintegrate orally, but you're swallowing them and they're absorbed the same way as an oral medication is. And then intramuscular, so I am basically, this is kind of hard to see, but the needle is going right into the muscle, and it has a slower rate than intravenous, which goes directly into the bloodstream. And IM depends on blood flow and which muscle you're using. And it also depends on which drug. So some drugs can only be given in the deltoid, in the arm, or the butt, or the thigh. And they're not as effective in shock. So if someone is in shock and they're hypotensive, there's not enough blood flow to the muscle and they're just not great. So another route should be chosen in shocky patients. And IM is a great route for when IV access cannot be obtained. And also it's just really convenient, especially when we think about epi auto injector. Epinephrine can't be given orally. You wouldn't want to give it orally anyway. It would take too long. And you don't want to really put an IV in, but if you could just jam this auto injector into someone's muscle and have it work very quickly, and it has prolonged serum levels, it's a good route. So again, the only thing that we as OEC and EMTs can give is epi via auto injector, unless you're under a protocol where you can give it another way.
Hey Nancy, I'm gonna stop you real quick if you want.
Okay.
We're at the halfway point, so let's give everybody a quick 10-minute break. And
Okay.
then we'll reconvene at for, since it's Eastern PA time, 8:12.
Okay, great. And if anybody has any questions that they can think of, put them in the chat and we can pick up with them. Okay, great. Thanks.
All right, everybody. That was 10-minute break. Hopefully you're able to go to the bathroom, get some more coffee, and I am going to turn it back over to Nancy for the second half.
Okay. See this bar. Hold on. Let me get. Wait, I'm going to stop. There we go. Okay, can everybody see that? All right, some really good questions came up, and I'm going to address them. So a couple people asked if I could share the deck. Eric is going to share the recording with you guys. I kind of don't, I hate to be that person, but I kind of don't want to share the deck because there've been some stories of appropriation of materials. So you can contact me directly. You could do screenshots from the recording, and then if you want some particular things, you can contact me. A lot of this is originally from the textbook chapter, and then a number of my Basecamp RX columns. Anyway, so contact me, but thanks for asking. Someone was asking about a wilderness EMT course. You pretty much can just go online and type in wilderness EMT courses. And there's probably like 4 or 5 well-known wilderness medicine schools. And the most well-known, of course, is Knowles. And you can look, there's a lot more, it seems like there's a lot more out west since I've moved out here. There's some local ones in Bend as well. So you just have to look online and try to find them. And you may have to end up traveling, but usually they're in really nice places. So lots of good wilderness. Someone asked about over-the-counter Primatene Mist. And it's really interesting you asked that question because there's an article coming out in the Basecamp RX column in Wilderness Medicine magazine about the different formulations of epinephrine. And there's a new, and actually when we get to intranasal, kind of stealing the thunder, but there's a new intranasal epinephrine formulation out. It's called Neffy, which is fantastic. So you don't have to worry about the injection. And it's supposed to be just as effective as the IM auto injector. Primatene Mist was something that was around since the 60s or 70s, and it's epinephrine in an inhaler. And I remember this when I was a kid. I never had to use it, but people were taking it either for asthma or if they had a really bad cold and they had wheezing. And it was taken off the market for a while because it had CFCs, those propellants that were damaging. Then it came back on the market with HFAs, which are a different type of propellant. But what you're getting in the mist isn't good to treat either asthma and definitely not anaphylaxis. So you would not want to do that. And so that, yeah, so that's, and they've done studies with, actually with an inhaler, and you couldn't possibly take enough puffs in a short enough amount of time to get a high enough blood concentration to overcome anaphylaxis. And if you're in anaphylaxis, you wouldn't be able to puff on an inhaler anyway. So, but that's a really good question. And then someone mentioned we're talking about being limited by your practice level in your state, but there's the Interstate Compact Act. I just looked it up on Google, which allows during an emergency and other situations where you can travel across state lines and have your certification recognized. So that's a really good poster, the Interstate Compact Act. Okay, so someone's asking about extreme temperatures, and I am going to be talking about that. Okay, so let's see how much time we have. All right, got a lot to get through in 40 minutes. Okay, so here's just another oral formulation suspension. Suspensions are great for people who can't take tablets, especially if they're big horse tablets, but they're bulky. Think about packing this in a medical kit. You have to have water, which I'm sure you always do have water, but they're not very stable. You know, when you use them at home for your kids or for your dogs or for you, they have to be kept in the refrigerator. So think about taking that on a desert trip. So you definitely wouldn't want to do that. Okay, so more routes of administration. We've got topical or transdermal, slower absorption, and it's pretty much a local. Topical is a local effect. Transdermal, think about nitroglycerin patches. That is going to be a systemic effect. So this slide just happened to have both on it. Topical are convenient, but technically, again, as I talked about in an earlier slide, maybe for burns, you could use like an antiseptic cream or an anti-itch cream. So pretty much everybody can use these, but we don't use them that much in OEC anyway. Inhalational, it's rapid and effective. It goes right into the lung. There's powders, sprays, and aerosols. And again, we can assist with a multi-dose inhaler. And I already talked about the nebulizer. Some people are able to administer that. Nasal, so going right into the nose, you've got rapid absorption, high drug levels, and again, doesn't get metabolized by the liver. I'll explain that a little bit better. There's certain drugs that get metabolized by the liver sooner than they're able to exert their effect. So for some drugs, they're not really good to be given orally if they're going to be deactivated by the liver before they can even exert their pharmacodynamic effect. So putting something right into the mucous membranes of the nose works for some medications. No needle. And as we know, we can all administer naloxone. And then, as I just mentioned, now epinephrine. This was just approved in August. And then they just approved it for pediatrics. I think it was last week. So now we can give intranasal epinephrine. Don't know whether that'll get to OEC anytime soon. But I would hope that your medical directors at your resorts will allow this. Okay, so here's everyone knows what a meter dose inhaler looks like, and there's the Neffy. So that's the epinephrine. Looks really easy to use. Okay, so then we're switching to, this is where pretty much only paramedics or clinicians can use these routes. So IV, and the great thing about intravenous is it gets right into the bloodstream. But problems are you may not be able to establish IV access. You need all the equipment. If someone's dehydrated, their vessels shrivel up and you can't really establish access. Extravasation, there's a danger that the needle can come out of the vein and go into the tissues, and then you've got raw drug right in people's tissues. This is only for higher level providers. And actually, on our mountain, the pros are the paramedics only are allowed to carry these types of um, equipment with them. And we have the mountain's pretty big, and if people are like 45 minutes from getting them off the mountain, this is where you might have to use this type of thing. But they don't use IV that much. Subcutaneous is into the subcutaneous layer of the skin, the kind of fatty layer. The absorption slower than IV, but it's still pretty rapid. And you use this when you can't give someone an oral medication, or if someone is in pain or vomiting and they can't take oral medication. And then insulin, there's certain drugs that can only be given a certain way, and insulin's one of them. And then intradermal is basically even a higher level in the skin than subcutaneous. And this isn't used for too many drugs. Rabies vaccine can be given this way. And if anybody's had, I'm sure we've all had TB, PPDs, that's intradermal. Okay, and everybody probably knows what a vial, there's an ampule, prefilled syringe. This is a multi-dose vial. So these are useful to take on extended trips. They have a preservative in them, and that's why they're multi-dose. Okay, and then these I'm going to run through really quickly. Orogastric, there's not that many drugs that are given directly from the mouth to the stomach. This is more of a hospital type thing. Nasogastric. And then intraosseous, this is generally not done in the field, but this is where if you can't establish an IV drug, if you can't establish an IV line, and if someone's hypovolemic or they're in respiratory failure, low GCS, you can administer the drug. It goes basically right into the vessels in the bone. It looks like it's really painful. And then endotracheal, so drugs can be administered directly into the endotracheal tube, and that's if you can't establish IV or intraosseous access. And the types of drugs that you see there are lidocaine, epiatropine, naloxone. This is the other one I talked about was topical. Transdermal, again, very few. You're not going to use this in the field that often. There's not a whole lot of drugs that are transdermal. You think of things like estrogen patches, testosterone patches, again, like nitroglycerin, not really a wilderness medicine thing. Intra-articular, you're not going to use this much in the field. I have gotten a number of intra-articular shots in my shoulders, steroids. If anybody's had them, they're really painful, but they work. Okay, and then these are pretty much only for clinicians, any sort of like prescribing or administering drops for the eye. So things like antibiotics. We can use over-the-counter eye drops. There's over-the-counter antihistamines and Visine and things like that. But anything that has a drug in it would only be clinicians. Same thing for eardrops. You can put swimmer's ear in your ear, which is alcohol and glycerin, but if it's got a drug in it, that has to be prescribed and administered. And then same thing for rectal and vaginal administration. Okay, we're going to talk real quickly about the rights of a medication administration. If anybody's a healthcare professional, they know what these are. We don't talk about these we don't talk about them in OEC, I don't think. Right patient, right medication, right dose, right route, right time. So you'll see the 5 rights. You'll see the 9 rights. I saw something, I think it was the 11 rights. So it's depending on who's doing the writing, there's different types of rights. So in a wilderness environment, when you want to make sure, the bottom line is you have to have the right patient. So make sure if you're giving a drug, it's the right patient. So if a patient needs to take their own medication for an acute condition, make sure it's theirs. So if someone came in with chronic hypertension, and they didn't take their drug that morning, make sure that it's their drug that they're going to take. If there are multiple patients being cared for, make sure the right patient is getting the right medication. And again, this is more of a situation where you're leading a trip or if there's a group medical kit. The right medication, so if, and this is sort of like the right patient, if a patient needs to take their own medication, check the label. If a prescription medication in a group box needs to be given, it needs to have the correct certification or authorization. So an example would be, let's say someone has really bad nausea and vomiting, and you have Zofran in the medical kit. Make sure there's someone on this trip, and you wouldn't be bringing this anyway if there wasn't someone on the trip who had the right certification to give it. So again, this is a we're talking about prescription drugs. The dose, if the medication is over the counter, make sure the correct dose is given for the patient and the condition. So if you are going to go into that supply of over-the-counter drugs you brought with you to try to treat every single condition, make sure you know what the patient's condition is. And that's where your sample comes in, right? And then if the dosages may vary based on their condition, age, and other factors. If they have to take their own medication, check the label. That's repeated over and over again. And again, if there is a prescription drug, someone has to have the certification, the authorization, and the knowledge. They have to know what dose they're giving. The route may be different in a wilderness setting, as you might not be able to bring everything. So there might be something in the medical kit that you would have used in a hospital setting, but not in the wilderness. The time, so patients may be on medications for a longer period of time if you have like a longer evacuation period. So if someone needs to have repeat doses, make sure that they're given correctly. And that, I think, primarily of pain for that, make sure you've got enough pain medication for somebody. And then documentation, you always have to do this, even in a wilderness environment. You don't have to do it when you're with your family, but if you are a group leader and you are administering medications that are not the patients, or even if they are the patients, it wouldn't be a bad idea to document all of that. Okay, and then you want to have the right response. So you want to monitor the patient, just like we check CMS before and after splinting. If you give them a drug, you want to make sure they're feeling better. And this is especially where you're in acute setting, you've got hazardous conditions, you're going to have delayed to definitive care. You want to make sure that the drug that you're giving is having the desired effect. And then I have this in red for the expiration date because we're going to talk about it. You want to see if the medication is within a safe date to use. And this is what we learn in OEC and EMS and all the other certifications. You want to check the expiration date, right? So nitroglycerin, you check it on the albuterol inhaler, you check it on the EpiPen. So this is how you read an expiration date. Everybody should know how to do this, but just to review. So if something says expires 3/2025, that means the end of the month. So March 31st. If it's February, it depends on whether it's the leap year or not. So it's 28th or 29th. Other ways the expiration date could be expressed is it can just say February instead of the number. So that's February. So this year we don't have leap year, so it's 28th. It can have the day first, so 12 April. It can have the month, the day, and the year, but globally, most other countries, just like the metric system, they do the day first. So this is where you need to be careful, because is this December 4th, 2025, or is it April 12th? And for the most part, I think most expiration dates are usually the end of the month. They don't have days so much. There might be over the counters that have days. So you're pretty much going to have it's going to be the end of whatever the month it is and the year. So drugs that should definitely not be used past their expiration date. So everybody we know is guilty of using drugs past their expiration date, and they're fine. And as a pharmacist, I shouldn't be telling you to take drugs past their expiration date. But we all know that, you're not going to run right out and get more Motrin if it's expired, a month ago. But what happens to drugs is eventually they don't work anymore. So if you've been holding on to something for 5 years, it just might not work anymore. So it's a good idea. A general rule of thumb is you should get rid of something like at least, and don't quote me on this, but like when they give you a drug in a prescription bottle, they put a year on it and they say get rid of it in a year. And that's because it's been taken out of the original container and put in a prescription bottle. The drug in there, taken out of the stock bottle, actually may have a longer expiration date, but this assumes, whoever made up those rules in the first place, this assumes that it's stored correctly. So if you're storing this in your medicine cabinet, and we'll talk about different conditions, it's you just, you can't guarantee the expiration date. So there's certain drugs that you absolutely don't want to use past their expiration date. Those that lose potency very quickly, and big ones are insulin, nitroglycerin, and then others that you see here. Seizure drugs are especially sensitive. So this is why you don't want to give someone expired, or don't allow them to take expired nitroglycerin. Although again, there's this, you've probably seen, we talk about this all the time. Do you give someone an expired EpiPen? The answer is no, you're not supposed to, but I think we all know what we would do if we were faced with that decision. So drugs that have a narrow therapeutic index, that means there's a narrow range between toxicity and efficacy. And so if they're not in date, you want to stay away from it, especially things like anticonvulsants when someone has a seizure disorder. And then anything that is sterile, so anything you're putting in your eye or your ear, you definitely, and that's where I draw the line. I don't use expired contacts. I don't use expired eye drops, just because you've been using them repeatedly and they lose their sterility. You don't want to add insult to injury by getting an infection in your eye. Okay, and then a few more rights. You may need to use a medication that would not ordinarily be used in an urban environment. So let's say you're going to altitude, you're taking altitude medications. We've said this before, the practice always has to be within your scope of care. You may need to help the patient with their own medications. So you don't know what somebody's taking in their tent. And this is why sample is so important, because we're all taught to ask people what medications they're on, and we're all taught to recognize the effects of some medications. Remember our substance abuse lecture. So we may not know the effect of a blood pressure medication, except that the person's blood pressure may be lower. But again, we may be called upon to help people with their own medication. So we should have a general rule of what the drug is supposed to do. And then these two are in red because we're going to talk about the environment. So this is somebody was asking, the environment may impact the stability of the medication, and the environment may impact the patient's handling of the medication. So storage requirements for drugs, hopefully everybody has seen these. So all drugs have a storage at, so in the US, it's got Fahrenheit, and everywhere else it has Celsius, but in general, it's got both. There may be other considerations. Do not refrigerate. Some drugs just say store. Like this is an over-the-counter, store at 20 to 25. It doesn't say do not refrigerate. I don't think many people are putting their Benadryl tablets or capsules in the refrigerator. But because refrigeration can be harmful to the potency of epinephrine, you specifically don't want to do it, and you want to protect it from light. Here's insulin. You want to store it in a refrigerator. You don't want to freeze it. So if it's saying do not do something, it means that it's actually harmful to the drug. Discard after expiration date. Again, insulin's one of those ones you don't want to use. And then here's pretty much all over the counter. I remember the days where over the counter drugs, just like food labels, didn't exist. But now you see all of this on over the counter drugs. Okay, this is kind of a busy slide, but these are the conditions to which drugs can be exposed when you're in a different environment. And some drugs are just more susceptible than others. So high temperatures, if you're traveling in the desert, you're on some type of ship, in a plane, not necessarily when you're in the in flying, what's the word I'm trying to think, commercial, but if you're like on a smaller plane, for example, taking an extended trip, you want to make sure your medications aren't exposed to high temperatures. Low temperatures, you're in polar regions, you're cave diving in ice caves. High humidity, you're in the jungle. Light exposure, you don't want your medications in plastic containers exposed to light. Shocks or vibration, this is just even dropping medications, they could break. Pressure, so if you're at high altitude or under the ocean, again, well, you're probably not going to be physically, well, actually, yeah, think of people that are working in those underwater laboratories. So, and it's interesting that they study, somebody out there, some pharmacologist does study the effect of what's happening on medication stability in these different environments. And like I mentioned, in space, we're soon going to be finding out more about what is happening in space. X-rays, radiation. So I'm thinking of radiation if you're in space, you know, where you have no protection. We don't know the answers to all of that yet. Putting your drugs through the X-ray machine at the airport, this is a question that's asked of TSA, and it does not affect medications. And then pests and rodents. So if you're working in a clinic in a small town in a third world country, or even around here, you can have animals getting into your drug supply. Okay, this, I'll go quickly through. This is the effect of, specific effect of the environment on stability. So vaccines, we don't deal that much with. But just to give you an example, a lot of vaccines are light sensitive. They can't be frozen. They can't be stored at high temperatures. The antivenins, so you've got, again, scorpion and snake venins are all biologics. And anything that's a biologic, that's a protein, doesn't like high temperatures or sometimes even low temperatures. Insulin, we know, needs refrigeration, and it can't be frozen. Epinephrine, we saw, can't be protected from light, shouldn't be refrigerated. And then this is the only thing I'm going to say about medical devices. A glucometer can give false readings if it's not stored properly. So if someone's traveling in a cold, I'm thinking more of a cold environment. And then we all know that pulse ox can give a false reading in a cold environment. And then here's what can happen to drugs if they're not stored properly. And then this is more for, this is really kind of getting into the weeds, but this is more for you to think about for yourself. At high altitude, your body undergoes hypoxia, you've got circulatory issues, you can be dehydrated, solar radiation. If you have acute mountain sickness, you could have changes in your mentation. And there's certain drugs that can be exacerbated by these conditions. They found that at high altitude, people need more insulin. Nitroglycerin actually works better. If you've got if you have an altered consciousness, then sedatives could make you even drowsier. And that's why you're not supposed to drink alcohol when you're on these trips, especially if you're climbing Mount Everest. Compliance issues, if you're not totally with it, you may not be taking your medications properly. This is a good one. The sun can cause photosensitivity or phototoxicity. And there was a doctor that used to come into the pharmacy when I worked in the hospital in Philly, and he would prescribe tetracycline on purpose when he went to Mexico so we'd get a better tan. This is not really a very good idea, but if you are taking these medications or have to take them during your trip, you definitely want to use more sunscreen. Some drugs can interfere with the body's ability to dissipate heat. So drugs, this is spelled wrong, anticholinergics, these are things that, even think of the antihistamines like Benadryl, that has an anticholinergic effect. And these things can inhibit sweating. So if you're in an extreme heat environment, that could make it worse. Diuretics increase dehydration as well as alcohol. So you want to be careful when you're in these extreme environments. Diving is an interesting one. When you're under the water and you're breathing gases, especially the deeper you go, and if you're doing mixes of gases, you can actually have a different effect of a drug in your body if you're taking a drug. So all of these diving organizations have drug lists. And then if you're in extreme cold, some drugs can suppress shivering, or cause poor circulation. So that may not be a good thing if you're in the cold and your body is not allowed to do what it's supposed to do to tell you that it's getting too cold. Okay, and then so I sometimes take it for granted that I know a lot about drugs because I've been doing it for 40 years. But if you're involved in this, again, as you don't have to know that many things as an OEC technician, but if you're going to be involved in wilderness medicine, if you're going to be taking trips, and especially leading a trip or just your family, you want to arm yourself with information. So there's some really good resources out there for the wilderness medicine stuff. These field guides are great. I love this little book, the EMS field guide. It's divided into different topics. Everybody's probably familiar with the physician's desk reference. It's like the encyclopedia of drugs, but now it's available mobily. Drugs.com is if you want to know anything about any drug. And I put this in here. You can now type, and I do this frequently because when I go on trips, I throw all my medications in a bottle together. And sometimes I forget what they are. So you can go onto Google and you can just type in the name of the pill and the imprint, and it tells you what it is. Hippocrates is a great online source. There's a mobile version of it. And then this guy, I worked with him for a period of time. This is a physician who's in Lehigh Valley, who's developed the only, I think, there may be more now. You can order a prescription, you can order a medical kit with prescriptions in it. And he and another physician he works with customizes the kit for you to either take on your trip. So this sort of answers the question of, he doesn't do it really for, I don't know whether he does it for expeditions or not, because that's getting into a sticky territory. But he will prepare one of these for you and your family with prescription medications. So again, it's just important to know, especially the over-the-counter stuff, if you're going to buy it, know what you're buying and what it's for. Okay, so now we're going to get specifically into how to pack a medical kit. So you don't have to bring everything and the kitchen sink when you go. I mean, that would be the most awesome thing if you could just bring everything, like when you're packing for a trip, to just basically bring everything. So you want to put some thought into it. Okay, so factors to consider on when you're creating a medical kit is the purpose of the trip. So you want to, is it recreational? Is it a high altitude trek? Is it a search and rescue? Is it a disaster area? The size of the party. So if it's a large party, do you want to have participants share the load? I would not let just anybody take the medical kit that has the narcotics in it, but you may have people share some of the medical supplies. Will there be medical personnel at the destination? So you can like trek up fewer drugs if, like, we did the Everest Base Camp trek. And so there was a medical tent up there. So the physicians who were the medical people on the trek with us took, fewer medications because they knew that there was going to be staff at the end of the trek. You want to consider the time for rescue and definitive care. Again, you may have to plan for an extended evacuation, like on a river trip, or if you're in the mountains. The length of the trip, you may not be able to take everything, so you might want to consider resupplies if it's a really long trip. You want to take into consideration participants' medical conditions and age. You want patients to bring their own medications. So this is where I'm going to go into you want to take a medical history. And if you're running a trip, or if you've ever been on one of these trips, the intake forms that these trip organizers give, I don't think are that good. But because I think they really need to know what the medical conditions are of their participants. But everybody should be responsible for their own medications. So you can have a backup supply in the general medical kit, but you don't have to bring every single antihypertensive or every single prescription, ulcer medication. People need to bring their own meds. The ones that you would want to have in the kit are the ones that are for emergencies. So if someone's having a cardiovascular emergency, respiratory emergency, etc. So again, you don't have to bring everything. Bulk, weight, cost, and accessibility. You want to try to use multifunctional medications. There's some things that can be used for a variety of things. Improvised materials. We'll talk about modules, kit modules to organize the kit. Destination, it's kind of the purpose of the trip. So, consider the terrain and the weather. And then also what endemic diseases are going to be in the country. So that's where you want to be prepared and get your shots and bring your malaria pills and things like that. Medication factors, so storage and stability. We talked about which drugs are susceptible. And then narcotics is a whole other discussion, especially when traveling internationally. You have to be very, very careful documenting narcotics. Everybody's probably seen Midnight Express. Like, you do not want to be caught with narcotics. And actually, when you're traveling internationally, you technically should have all your prescriptions in a separate bottle with the prescription label on them, and don't dump them all in a bottle like I said I just did. They rarely check, but if you're going to some sketchy countries, it's probably a really good, not probably, it is the best thing to have all your prescription drugs labeled, especially in a med kit. And then again, we talked about this a lot. You only want to use the equipment and medications for which the group's trained. Okay, so you want to take a drug history before administering medications. You don't have to do this on smaller trips, but if you're going to be on a big organized trip, you should be doing this. And this is our sample. So we're asking about allergies, medications, pertinent history, especially blood thinners. We know to ask that question if someone has had a head trauma. Drug interactions is a little tough if you don't have training on this. But it's useful to know what medications people are on, and again, allergies. And then this is the types of things that you want to think about when you're creating your kit. You want to make sure it's customizable. So for the environment and the purpose, we talked about considerations for traveling internationally, especially narcotics, the contents, what drugs will you be taking, and as I mentioned, what are going to be life-saving. So in your general medical kit, you want to bring those ones where you can intervene quickly. How big? Is it smash proof? Is it protected from light? Do any drugs need refrigeration? And then do people accessing the kit have the knowledge, and do they have the proper certification? So for your personal kit, you can get this pre-made kit on Amazon for $28.99, and it's got everything in it. Of course, we all do this, including our drugs. I don't show the drugs here. So this would be your personal kit. For a group kit, it's going to be a little bit more complicated. So this is one that a physician who does wilderness medicine training in Pennsylvania at his house has this terrific kit that he brings to conferences. So he's got So again, this is for a big group and a big expedition, but you want to make sure the drugs are protected from environmental conditions. You want to pack drugs for each medical condition. So there's your modules. So here's an anaphylaxis kit. You want to make sure the drugs are labeled and the expiration date and the storage is visible. And again, you need to know the storage condition for your drugs. If any of these have to be refrigerated, they shouldn't be stuck in the main pack with the others. For oral medications, blister packs are great. If you have a blister pack of, this is Vicodin, I think, or Percocet. If you have a blister pack of a prescription medication, it still needs the prescription label, even though even if it's in the blister pack, it's still a prescription drug. And then here's an example of taking loose pills. So you could put loose pills in one of these little plastic bags. These are awesome. They're much better than taking amber pharmacy vials and have a prescription label. And your pharmacist can do that. And then we have these for our trauma packs in our aid room at Mount Bachelor. There's a list on the top of the pack, and it's got everything that's in the pack. So again, this is for a very involved, sophisticated expedition where you're going to need just about everything. So this is the supplies and the medications. So here's an example. This product's called Frio, and it's a cooling pack for medications that need cooling. So insulin's the best example of that. And that's an insulin syringe. And don't forget, if your doggy is coming along, you want a first aid kit for your dog. And there's actually, I downloaded a first aid, it was a book on first aid for animals. It's in my phone. And I think I mentioned a lot of those resources, the drug information resources, you can download on your phone. That's the best place to have them, unless you don't have power. So that's why you always want to bring backup power. But I hike with my dog a lot in the wilderness, and you should bring the same things that you bring for yourself for wound care, to get out splinters. Um, some people bring what's this, like super glue or Surgic glue if their dog cuts their pad. So you always want to remember your furry friend. And I think that's it. I know I kind of rolled through that second part, but it really built up on the first part. So let me see what some of the questions. Okay, OEC does cover the basic 5 rights. Okay. Um, I don't know how long the Frio pack lasts. That's a good question. I'll have to figure that out. Okay, someone pointed this out. It's great. Hippocrates does provide you drug interaction information. So I haven't used it in a while. So that's good to know. So if you're dispensing a medication and you have the patient's medical history, you can use Hippocrates for drug interactions. Oh, here we go. Here's the Frio. Thanks, Ed. So the Frio can maintain a safe temperature for 45 hours. Wow. And can be reactivated by soaking it in water for continuous cooling for up to 28 days. That's great. All right. Any other questions? So I was talking with Eric and Linda and Larry, and if there's any other topics that follow along with this lecture, we can go into more detail with the different lectures. So if you guys have any ideas, we will certainly put something together. So again, we're trying to focus on, I know the 3 of us are trying to focus on wilderness medicine type stuff because that's what we really love. And if any of you are going to become, I'll say it again and again, if you're going to become more interested in it, try to get to these conferences. Pick up Seth's book. The old edition of the book is probably cheaper now because the new one will be coming out within a year. And just get out there and have fun, but also know what you're doing.
All right, looks like you're getting a bunch of thank yous. We'll open up case anybody has any questions, we have 5 minutes left. So feel free to ask questions. Otherwise, thank you for attending and we'll see you for the next one.
Yeah, and thanks everybody. It was just it's always gratifying when you have a lot of people and they ask really good questions. So I really appreciate it. And come on out to Oregon to ski. It's awesome.
Well, I believe one person asked if they can have your contact info in case they have any other questions.
Yeah, you can give them my email. Or I could let me put my email in the chat.
I will also make that available when I send out the recording. I'll include your with it.
Yeah, why don't we do that? And then you don't have to worry about getting it from the chat. Yeah, so anybody can contact me anytime. I love teaching and I love this stuff. And if you have any suggestions or clarifications, please send them to me. Because I am not, I'm not running on an ambulance, even though this is wilderness medicine, I'm not running on an ambulance. There may be new meds out there. There may be new procedures that I'm not aware of. I try to keep up to date with everything, but you can't be in every single practice setting. So any suggestions, anything I might have missed, I'd appreciate it.
Eric, Hans asked if there's anything he needs to do for the Con Ed.
I will be sending out the Con Ed, so those who are in Pennsylvania, I will be uploading your information and you'll receive a certificate. Those who are OEC only, I will email you a certificate that says you attended. Anybody who's out of state, I will also send you a letter of recommendation. Sorry, not a letter of recommendation, a letter of endorsement. This way, everybody has access and they hopefully can get Con Ed. Okay. Well, then I am going to say thank you again for coming out. Thank you again, Nancy, for taking time to present. And we will see you on the next one.
Bye, everybody.
Thanks, Nancy. Excellent.
Bye.